A lot of people are still worried about the pandemic, including medical experts. They fear what the future holds as COVID numbers keep rising. And I'm told we have Amber now. Amber, what are local medical experts telling you?
Well, Cherish, medical experts tell me that we saw a major spike in April and July. Now, here's where it gets a bit tricky. Unfortunately, the daily numbers that we are experiencing right now are driving close to what we saw in April. And they say if we stay on this trend, we will outpace those numbers. Dr. Scott Shavers, epidemiologist and head of COVID response for the Mobile County Health Department, says what we are seeing now in terms of the increases in numbers and cases and hospitalization are directly related to community spread. In our first spike back in April, Dr. Shaver says they saw about 100 cases a day for hospitalization. Today, we have surpassed 90 cases a day. Now, that second spike that we saw back in July, which is what they consider to be a big spike for the state of Alabama, we started to see over 200 hospitalizations per day. Now, with numbers rapidly increasing by the day, as we enter into the flu season, they fear that this could outpace the capabilities of the hospital systems.
We have not had that prior. And if you start to overlay the curves for seasonal influenza with COVID, that can rapidly outpace the capabilities of our healthcare delivery systems with respect to the number of beds, but also staffing, PPE, and treatments that are available.
Right now, hospitals can handle what's coming in. They can flex in terms of putting patients in other parts of the hospital and send patients to other hospitals if needed. Now, Dr. Shaver says there is hope on the horizon as we are hearing that vaccine will be available sometime before the end of the year. But in the meantime, we must wear our masks and definitely social distance as we go into the holiday season. Cherish?
And Dr. Shaver says that emergency authorization was just given by the FDA, correct, Amber?
Yes, Dr. Shavers tells me that the FDA just gave emergency authorizations approval, and they'll do their final analysis probably by the end of November. And we should expect a second vaccine right after. But once again, he cannot stress the importance of wearing a mask and definitely maintaining that social distance. As far as the timeline, the first phase, we should see that by the end of December. And the second phase for the general public should be handed out by sometime in the spring, maybe March, April, sometime in that time. But coming up at 6, I have more sound and interview with the Alabama Hospital Association, just talking about and putting things in perspective as far as when it's time to tend to one COVID patient, how many nurses and staff that they need to tend to just one patient. And I think that will help bring perspective as to what we're dealing with right now. But for now in Mobile, I'm Amber Grigley, WKRG News 5.